Hi, this is Dr. A, and I am here with your third installment of Chapter 4 in Public Health for the fifth edition of the Basics of U.S. Healthcare System for Intro to U.S. Healthcare class. And we are going to dive into some examples here of public health crises and problems. This is pretty cool. So we're going to look first at the collaboration of public and private medicine in the opioid epidemic. So there have been three waves of the opioid epidemic: the 1990s, 2010, and 2013. And so you can see, this goes back to 1999, but when kind of started, and you have a wave here and then another wave here. According to the CDC, the number of drug overdoses death increased by nearly 30% from 2019 to 2020 and has quintupled, so it's five times more than what it was in 1999, so it is greatly increased. Nearly 75% of the 91,799 drug overdoses death in 2020 involved in opioids. That's 3/4 of overdose deaths are related to opioids. And from 2019 to 2020, there were significant changes in opioid-involved death rates. So we have opioid death rates increased by 38%, prescription opioid death increased by 17%, heroin deaths rates decreased by 7%, and synthetic opioid death rates increased by 56%. The pandemic also had an impact on drug abuse, notably increasing it. So I found this graphic too on the opioid epidemic by the numbers. On average, 130 people die every day from opioid-related drug overdoses. This is an estimate. 10.3 million people misused prescription opioids in 2018, and it's been increasing. There are 2 million people that had an opioid use disorder in 2018, and 2 million people misused prescriptions opioids for the first time. So there's a lot more numbers there. It is quite sobering to see what is going on with this epidemic. So we're going to look at a case study in this epidemic, the Sackler family and also Johnson & Johnson. So Purdue Pharma was created in 1952 and is owned by the Sackler family. They started manufacturing OxyContin in 1996, and it was a reformulated drug from oxycodone, which was created in 1916, but then was taken off the market in 1990 due to addiction issues with use. So this drug became the center of the opioid addiction crisis. And what was happening is that the Purdue Pharma was marketing this OxyContin as a non-addictive alternate to oxycodone. And this, of course, message was a false message. And this really caused this epidemic to just really catch fire and spread. In 2019, the Sackler family was sued by the Southern District of New York, Massachusetts, Connecticut, Rhode Island, and Utah with 1,600 cases for their role in encouraging prescribers that OxyContin was non-addictive, which was a lie. The Sacklers would then agree to no longer produce opioids and pay billions to a charitable fund. Well, ultimately, in March 2022, the Sackler family has agreed to pay $6 billion to settle the lawsuits and to publicly apologize. The whole saga is dramatized in a really cool series on Hulu called Dope Sick that is worth seeing. It's really well done about how it started and how it spread. And how the Sackler family and Purdue Pharma reacted to it. Interestingly, they just went up recently, so this is end of June, going into July 2024, and it was a decision by the Supreme Court about their bankruptcy. They're filing bankruptcy, and they were the Sacklers were trying to protect their individual individual wealth, separate from Purdue Pharma, and I believe the Supreme Court rejected that motion in part of the bankruptcy filing. Johnson & Johnson, in March 2022, a $26 billion settlement was finalized between Johnson & Johnson, 3 pharmaceutical distributors, and the state and local governments that's regarding the role of Johnson & Johnson in the opioid crisis. They will be paying $5 billion, and the 3 distributors will be paying $21 billion to state and local governments, which of course are left dealing with the fallout of this epidemic. Now, another interesting topic for public health is the measles case increase. So in 1998, in The Lancet, a prestigious British medical journal, it published an article by Dr. Andrew Wakefield that implied that there was a link between vaccination and autism. So there were issues with the research quality, but it took the journal 12 years to retract the findings of the article, and during that time period, the research had been cited worldwide, and so the result was that parents did not have their children vaccinated for measles for fear of their child becoming autistic, despite the fact that measles can be fatal. And so what happened there now is, like, according to the CDC, during the first 5 months of 2019, there were nearly 1,000 cases of measles, so it's resurging, right, reported in 26 states, which is the greatest number of cases since 1992. And this attitude is tied to whether parents will vaccinate their children against COVID-19. So you can't deny that the measles vaccine is effective. I understand the parents' concerns, and I firmly believe that autism must have an environmental cause of some sort. It cannot be genetic because of this sharp rise in cases that we have seen. We just have not been able to completely pin down. It's very difficult sometimes to pin down environmental causes because there are so many things that we are exposed to in a lifetime. But it would be interesting to see how it's going to go. But it still is the public health crisis here is this increase of measles cases, which are totally preventable with appropriate vaccination. Mpox, also known as monkeypox, it's a rare virus, and it is related to the smallpox, and it's in the same family. The symptoms are mild, but similar to smallpox. They're rarely fatal, and the rash is the main symptoms of Mpox. In 2022, the virus appeared in Nigeria. The spread of Mpox is through intimate contact, so that could be sexual contact, but like close skin-to-skin contact. The infectious rash, so anybody touches or is in contact with the infectious rash, or bodily fluids. It can also be contracted through fabric materials which were used by someone who has Mpox, so a shirt or something that was, something that was on their body. As of October 2022, there were 22,774 cases in the United States, which represented 2/5 of the world's cases. According to recent data, the number of cases has been declining over the past few months. All right, a little bit on misinformation and disinformation in the realm of public health. So misinformation is false and inaccurate claim. Disinformation is a subset of misinformation to specifically deceive target groups. These are often associated with healthcare, health conditions, and the pandemic also. And this type of information is often disseminated widely on social media, where it cannot be verified as true. So according to the Johns Hopkins Bloomberg School of Public Health, during health crises, there are 4 categories of misinformation and disinformation. So there's false information about the disease, false information about treatment of the disease, or it could be inaccurate also, false or inaccurate, right? It could be also conspiracy theories and blaming groups for the disease. So misinformation about the government and doctors during the 1918 influenza pandemic fueled anti-vaccination movements. We saw that kind of similar also in some of the later pandemics. And the widespread of misinformation campaign is called an infodemic, and is a term that was developed in 2003 during the first SARS outbreak syndrome that was mostly over in Asia. It's defined as a process of mixing facts with fear and rumors, creating distrust, and that spreads rapidly using social media and other media types. So this is kind of a newer thing in the world of public health, but it's definitely something that we need to contend with because, and again, misinformation can spread, and then people can be put in danger because they're not protecting themselves or they're not believing some of the information that could be that is factual. So this type of misinformation was also prevalent during the AIDS epidemic, so that was in the 1980s and 90s, and also in the COVID-19 pandemic, we saw a lot of that. The recent mpox outbreak has also been battling some misinformation spreading. And so, again, you always want to go to maybe even multiple trusted sources, scientific sources, to get your information. So in conclusion, public health is an integral component of life and surrounds consumers with educational opportunities to change a health condition and behavior. There's been several successful vaccines that have targeted childhood diseases and nearly eradicated them. Tobacco use has decreased significantly. Safer workplaces are part of common culture here because of OSHA. The fluoridation of water has been established to protect teeth. There's been a decrease in mortality from heart attacks, and public health and traditional medicines have been collaborating more to increase health of the nation. Public health can become political when national policies are implemented or if there is an epidemic and health officials are trying to contain the disease. And we saw this with the COVID-19 pandemic. And this type of policy then, like a national public health policy, can impact the individual's right to choose their behavior. An example was the mask wearing mandates to minimize the spread of COVID-19 and vaccination to protect individuals. So there are, a lot of the hospitals, if you came to work with them, or even if you were a student on a clinical rotation with them, you had to have a COVID-19 vaccine or the series. You have to be able to prove it, or you can go or can work with them or work for them. And we saw like with the mask wearing, like it was required to enter certain businesses or to go in public places. And so that's, again, it became really political, but that's an example of how one, public health can become political, how decisions can be made at a national level, and policies and the public sometimes can respond positively and negatively to these things. So, all right, well, on that note, we're going to conclude the chapter on public health, and our next chapter is going to be on population health, and I will see you there.